In 1897, the University of Southern California was established in the heart of downtown Los Angeles.
USC is 120 years old. Created in Los Angeles when we were 40,000 people big. Dental school was created soon afterwards because the community, this 40,000 people, needed dentists.
One of the oldest and most well-known programs is the original USC Mobile Clinic.
The big start in community stuff was like in the 60s, and really the students got it started. The students at that time, you know, they were into service in the community and helping people.
And the idea was to get faculty to mentor students, put students together, and bring oral health care to populations that could not access.
Now, from Kern Golden Empire Television, 17 News at 5.
A group of Southland dentists are helping change lives and by brightening smiles here in the Central Valley. With help from a mobile dental clinic, they're brightening the smiles of many children in Arvin.
USC dental students volunteer to come to Kern County and lend a hand to work on the mouths of children from migrant families. 12-year-old Luis Garibay of Lamont is a very brave boy who realizes how important it is to take care of his teeth. That's why he patiently allows dental students to use all kinds of instruments in his mouth to help him with good oral health. Luis is the son of farm workers. His mother is currently not working, but says she will return to the fields this spring. A mobile dental clinic offering free work for her child is especially helpful. She says, it's very good, more for those who don't have insurance. It's very good help for the children's teeth to look good. They are one of hundreds of families accessing dental work for their children through the help of the USC Mobile Dental Clinics that visit the San Joaquin Valley several times a year.
California being the largest state in the union with numbers of children, and many of the kids were language-limited youngsters. They also needed health, welfare, everything that a poverty-stricken child would need. They were not eligible for many services that are normally provided to poverty children because they were transients.
More than 200,000 migrant children have families who follow the crops. This often disrupts the children's schooling, making it difficult for these students to get the same opportunities as non-migrant students.
At the core of the dental curriculum at USC is service learning. Every student is required to serve the community throughout their education in order to gain a much deeper understanding of the tremendous impact dentistry has on society as a whole.
They are having hospital-based dentistry, clinic-based dentistry, in a classroom-based dentistry, mobile clinics going out to remote areas and serving people who have no access to care. Our hope is all of that creates a highly talented, highly compassionate individual that we call a USC grad.
Here's a regional example of how Migrant Education makes use of outside community resources in providing health services.
So many of Migrant Education kids have had dental problems their whole lives.
Most of them need ear-to-ear dentistry. So most of these children are going to have to be seen 4 or 5 times to finish their dental care.
There isn't any kid that should go to school with pain when we have so many dentists in our country that can provide this care.
I think it is obvious when you spend just a few minutes with these children and with these families how great the need is.
These molars come in with defects, little pits. If you seal those pits, in addition to doing all the fillings that we do on the baby teeth, you can prevent decay. If you lose one baby molar, it requires a bridge, might require orthodontic care because the teeth will be crooked, or an implant. Over a lifetime, that one tooth could cost $10,000. By doing this stuff, we prevent all that.
We've tried to do a cost analysis of how much this would cost at like a private dentist. And we think it would normally cost a family between $1,000 to $1,200 per student to get all the work that they're getting done at this migrant clinic.
You know, if you got a front tooth missing, your image is not very good. If you got a nice smile, it's just one more thing to add to a person's self-esteem. Also, I think the fact that we're taking care of them with kindness, they kind of feel that somebody cares about them, a stranger cares about them. And I think that's very important. Joe, the guy that runs our trucks, he had some free care when he was a kid, and he says he wants to give back. He had 16 kids in his family, and they couldn't afford any dental care. That's why he's so dedicated to this program.
What I like about the program is the community outreach, helping all the farm workers' children who don't have medical or dental insurance available. I think that's the greatest, because that child's going to remember it, you know, growing up.
So they go into a community, they set up on a Friday, and from that Friday to the following Saturday, focusing, for example, on children, every child in that community receives comprehensive, complete oral health care at no cost to the child or their family.
Welcome to the USC Mobile Dental Clinic. Hi, my name is Dr. Jonar Bonifacio, and I'm the director of the mobile clinic. Day 1, the USC Mobile Dental Clinic. On this journey, you will meet my staff. Mr. Joe Sanchez and Richard Garcia hitch up the trucks, load up the supplies, and are en route to Kern County. In Kern County, they're going to pick up our trailers. We usually house our trailers in the Kern County bus yards. We are really thankful that Kern County allows us to store our trailers there. They'll rinse them off, hitch them up, and make sure they're ready to go to our next location. Our next clinic, Wasco. Upon arriving to Wasco, we'll see 120 of the most need kids. Joe and Richard and Epi ensure that our trailers are put together in a box formation. They make sure they're